Hello. Sorry, I just needed a drink. Hello to everybody who's here. I am a day late from what I normally am. I usually do Monday night live stream. Still was very much under the weather yesterday to where I didn't feel like I needed to be peoply. Still don't think I should be out taking care of patients right now yet. So I think we're going to hold off till Thursday and we'll see how I feel Thursday. I'm pretty good. So, anyway, a little backstory. This is Healthy Carnivore. My name's Laura. I'm a registered nurse. I've been a nurse for over 22 years. I did keto for 28 years, and then I've been carnivore for 5.5 now. So, is it foggy where you are? I feel like the entire United States is foggy. Like, I was on, I don't remember who I was watching, somebody's YouTube earlier today, and they live like in New Mexico. I don't know. And they were like, "Oh, it's so foggy, we can't see through here." And then somebody in Florida, and now I'm in Illinois, and I was like, "What is going on?" I was like, "It's crazy." Um, so yeah. Let's see. I'm going to look. B says, Laura, may 2025 bring you internal peace, radiant health, and a bunch of prosperity. Thank you. I will take that. May you have the same. Also, I would have to say I'm going to be pretty damn healthy because this little virus got me down pretty good. So I'm going to go into a little bit of that, and then I'll go on with tonight's topic. So last Friday, got up, ran sprints, no problem, not shortness of breath, no issues. By 2 p.m., started coughing, had nothing come up. It was just a dry cough, but it was like from the base of my lungs. And I knew I had been exposed to whooping cough, COVID, and strep. So I was like, shit. So I called the doctor's office and I was like, can I be seen today? And they're like, oh, we have no providers here at all. And I was like, great. Nobody, not one provider, the entire place. Nope. Okay. Well, you can come to our walk-in clinic at 7:30 in the morning. If I'm still here, I will show up. So I did so. And they were very quick. The problem I had was I had requested blood work. I wanted a CBC with diff. I wanted to see if what I had going on was bacterial or viral because I had double pneumonia in 2019 that came on like the same way. I ran 15 miles that morning, went to see patients till noon, walked into my office um, to get, I think, supplies. And everybody's like, are you okay? And I was like, I'm fine. Well, I wasn't fine. And I had 102 temp at that time. And that turned out to be walking pneumonia, which was viral. So to me, I felt like this was probably viral. So I had done one thing of elderberry tincture and one dropper full of the oregano oil, just in case. And they diagnosed me with sinus infection and ear infection and said my lungs sounded a little coarse, not anything too horrible. Didn't think it needed an x ray and didn't really feel that they needed to draw blood. Now, normally, if I ask for something and I really truly believe it's something I need, I'm going to push. But I felt so horrible. I had no fight. I was like, fine. So that was Saturday morning. Sunday, by 3 p.m., my fever was extremely high, was starting to get shortness of breath, and was doing the oregano oil because they told me it was bacterial. Had quit doing my oregano or my elderberry tincture. And if anybody out here knows any nurses, we don't go to the hospital. We especially don't go to an emergency room unless it's really bad. And it was bad enough that I was like, I need to go to the emergency room. Had there been a walk-in clinic, of course, I would have done that because I felt like it was not ER level, but I had no choice. And upon getting there, my temp was 10, I don't know, 102.4. I am not a fan of Tylenol, but I had tried Tylenol and it really knocked it down like 5/10 of a point, and that was it. And then it would come right back up. So they did run the blood work like I asked. I asked them for an ELISA test. I asked them for PCR test. And it came back as viral. But it wasn't COVID. Whooping cough is bacterial, but it wasn't whooping cough. I had that test. That's horrible. Never going to do that test again. Wasn't strep. wasn't flu. So they're like, we don't know what virus it is. It's a virus. And I was like, and then they did a chest x-ray and said that I had the beginnings of pneumonia in my right lung, which I thought that's weird because when I would cough, it was my left lung that felt like fire shooting up when I would cough. Nothing in the right, didn't hurt at all. Um, and so I was like, perfect. But this is the crazy thing. They were like, well, we can give you antibiotics. And I'm like, for a virus? I was like, really? And of course, this lady didn't know I was a nurse. And she goes, oh, yeah, yeah. Sometimes they help in case this turns into bacterial. And I'm like, what? And she goes, yeah. And I go, no, I think I'm just going to go home and really hit my elderberry tincture and all the things I know what to do, garlics and stuff like that. I was like, no, I don't think we should be taking antibiotics for viruses. So anyway, so now I've been a full 30 hours of doing the elderberry tincture and I actually feel human. Now, I don't think I'm safe to be out driving because I do still have a little dizziness because the ear infection it is going down, but that swelling messes with your equilibrium. So um, I don't dog walk or anything, but I'm definitely not 100%. I did do 10 minutes on the treadmill this morning and felt okay. And then I did quite a few push-ups. I did 25 and then another 25, which is not anything compared to some people, but 50 push-ups I thought was pretty good. And the last 10 were girl push-ups, and I'm okay with that too. So that's my story, and I'm sticking with it. But yes, I do feel much, much better. And I hope everybody has a happy new year. So I see some people putting that in there. I agree. Kat says, Happy New Year's Eve. I'm so happy I got off work early. Oh, that's right. Yeah, your time's a little different than mine because I'm like 3:30. I'm glad you got off work early too. It's foggy in the mornings because there is a river not far from. Oh, okay. Well, that would make sense. Jill says, Happy New Year, Laura. Back at you. Laura Sluter, bright and sunny here in Idaho. Ooh, but 13 degrees this morning. Ooh, no. It's going to be very cold. I think today was like the last nice day, it sounds like, for a while. So I'm wrapping my mind around that and have all my warm cuddle duds to be wearing under my very thin, comfortable nursing clothes. Oh, my husband was like, "Oh, you look like you've lost some weight." Yes, 7 pounds. Um, but that is because I could not eat much. I could eat like 2 ounces of protein at a time. Um, didn't really sleep real well, but I'm sure I will put back on all 7 of that when I'm able to eat fully. Main thing is hydrating. The other thing I noticed is that these people that were at the hospital I was at were very diligent of washing their hands with soap and water. They weren't just using like the hand sanitizer stuff. And I was like, yay, I really, really honestly in my heart believe that washing with soap and water is 100 times better than using the alcohol cleansers ever. First of all, I don't know what it's doing to our bodies when it's absorbed in, except going straight to the liver, and I don't want that. So let's see. Karen says, hello, hi. And she says it's 45 degrees, cloudy, and windy. Yeah, it's very windy here. Yeah, I don't know. It's and our wind, yeah, the wind's coming out of the west. It was coming out of the north earlier and then it switched out of the west. So I'm not sure. So, okay. So let's get on for tonight's conversation. So this is all about carnivore healing. And I go over some of the things that it's been shown. I wouldn't say they don't want you to ever say that you can eliminate and cure a disease. But if you have cancer and you do chemo and radiation and they can't find the cancer, what do they say? You're cured. If you have type 2 diabetes and you fix it with diet, you should also be able to say you're cured. Now, is that to say that if you went back to that way of eating, the standard American diet, that you wouldn't go back to type 2 diabetes? No, you would absolutely. But it's like I kept that at bay so far for 33 years because it was 1991 when I was borderline. And really, I think if they would have had I don't think they had the test for hemoglobin A1C back then. They did triglycerides, they did um, fasting glucose, but I don't remember them running anything like a hemoglobin A1C. But if my triglycerides were over 1,000, I'm sure that my hemoglobin A1C was probably 10, really, just to be honest. Um, and I have kept that from ever rearing its ugly head for 33 years. So they may not call that a cure, but I do. So take that for what you want. Um, a lot of these diseases, and most of our diseases, really, if you get to the root cause, come from inflammation. It's an inflammatory process. So I'll go over some of the ones that I have seen this diet cure or manage if they want. They love to say manage disease because that makes them sell medicine to you so they can manage you, not fix you, just manage you. So the first one is autoimmune diseases. So, examples would be like rheumatoid arthritis, lupus, psoriasis, multiple sclerosis, um, eczema. And it says, why would this type of diet help? So from everything I have seen from all the years of watching people, listening to Kelly Hogan, Dr. Baker, Barry, Hampton, Kilt, he cracks me up, um, is that it's because it reduces and eliminates inflammatory processes. The other thing is when you get rid of these plant compounds such as lectins and oxalates and phthalates, and you promote and fill your body with nutrient dense products that are animal based, doesn't mean you can't be keto. If keto works, I say do keto. Um, but that is anti-inflammatory, which is so funny to me because in nursing school, what we were taught, if we had somebody that we were putting them on an anti-inflammatory diet, it was no meat. It was no meat protein ever, 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 ever. It was, yeah, it's just crazy what we were taught. So the most reported benefits from, those diseases that I named are reduced joint pain, the skin clearing, and improved energy levels. But with that being said, and I'm not a keto or carnivore policeman saying you have to eat lion diet like me. No, you don't. If keto works for you, fine. Ketovore works for you, fine. Carnivore works for you, great. Lion works for you, okay. Um, but just know that there may be times if you go off of what you have cleaned your diet up and you go back to something and it has some of those oxalates and phthalates and um, that those things can come back. Like you can get those rashes back. Excuse me. Okay. So another thing is digestive disorders. So probably the main one that you hear about on TV um, and probably out in this community is like your IBS and your IBS-C, your Crohn's disease, ulcerative colitis, and GERD. GERD is probably the number one thing. If you are a healthcare practitioner, you will see out. Um, I can't say that I have ever been in a patient's home in the last 2.5 years that they were not on some PPI, proton pump inhibitor, either omeprazole, Protonix, whatever it may be. Um, so the reason that this kind of diet would help with that is because removing the fiber and the plant antigens, which have been shown to irritate the gut lining, um, it would then, allow that gut lining to heal. Um, when you eat higher, like animal products, it boosts the collagen, which also helps if you think about, the inner layers, the outer layer inside the stomach, that tissue, all of that tissue that runs down the rest of your system, including all the way to the anus. Um, Very delicate skin and it needs collagen. And so you can't have inflamed tissue with all these areas of angry tissue and then you're pushing plant fiber through it that can't be broke down and wonder why you end up with bleeding and other issues. So when you switch, to a meat-based diet, you will definitely notice less bloating, reduced diarrhea or constipation, and you should have symptom remission. So if you're somebody who has been dealing with IBS, Crohn's, any of those kind of issues, and you're concerned about possibly thinking about going keto, carnivore, I really would promote carnivore for that. Um, More for that one, would be go look up on YouTube Kent Carnivore. His name is Lee. Wonderful guy, young kid, and he has a heck of a story. And he really is a champion for people. I wish there would have been a champion for him prior to him having to have his colon removed, but it's gone. That's okay. I don't have a uterus. That's okay. Sometimes that happens. Um, it's unfortunate, and I think it probably could have been prevented. And so I think he's a big proponent to send people to see his stuff. Another is metabolic disorders such as type 2 diabetes, prediabetes, insulin resistance. And I think the sad state of our health in the United States is that if they would go through and test every adult for insulin resistance, I would say the numbers would be absolutely shocking to people. Um, but I'd say I'm not afraid to say it'd be 75%. I just would not be afraid to say that at all. The reason that this type of eating, like carnivore, would help is because it stabilizes your blood sugar by eliminating carbohydrates, and it improves your insulin sensitivity. Reported benefits, of course, would be normalized blood glucose levels and reduced medication needs. I would add to that decrease chance of losing your eyesight, losing your kidneys, losing fingers and toes and feet and limbs, decreased erectile dysfunction, because those little teeny blood vessels are what pay the consequences. They pay the price for the high blood sugar. Um, and no offense to any men out there, but I will tell you, most of the diabetic men that I have worked with, I mean, they lost digits and they're like, well, and I'm like, you do know what's coming next, right? Like, you're going to have this issue. And then they're like, well, what do I need to do? And I'm like, that's what it took. That's what it took. You missing your foot is okay. Like, that's not as big of a deal. Okay. So, anyway, nice to say that the people that I had that discussion with did turn themselves around and are no longer diabetic. So, I'm very happy for that. But it was just eye-opening that that's what it took. So, another thing that the carnivore way of eating helps is with obesity and weight management. Now, with that being said, none of this is going to be overnight process, okay? Because you have to be completely healed to shed, especially that last 20, 30 pounds of weight. You might drop so much weight in the beginning, which is a lot of that's the inflammation and fluid and electrolytes. So make sure you're replacing those. But to actually get that last 20, 30, maybe even 50 pounds sometimes, your body has to be healed, because if you're not healed, then you still have inflammation. And so you have to get brass tacks sometimes. And sometimes you have to give up some of those things that you're like, I don't want to give up dairy. And it's like, okay, you don't have to, but that may be what's stopping. That may be that last little thing you have to do if you want to completely heal. Now, I'm not here to say you have to do it. It's just something that if you want to get better, you need to. So, the reason that this helps is the high protein, high fat foods promote satiation and fat loss by reducing your hunger signals, your hormones, and improving metabolism. So, when you eat carb laden foods, they break down differently in the body than fat and protein. Okay. They do not require bile. So bile will not shoot over into the small intestine and start doing its thing, which is why so many people end up with gallstones and sludge in their bladder, or yeah, their gallbladder, and then it basically dies off. Um, but when you eat the fat and you eat the meat, then you're utilizing that. So you're breaking down everything, and which improves your metabolism. It does all that, but it produces GLP-1. Our body does. And so eating the meat and the fats, you produce more of the GLP-1 naturally on your own. Not saying if you're somebody that is doing that medication that's a 100% no-no. You have to decide for yourself, um, as to where I know that according to the patients I had seen in the past, people we had taken care of, people, and they weren't coming there for weight loss. They were there for a different issue when I worked someplace. Um, they had every single symptom that you hear on the news, like in the commercials, I should say. The news is never going to say anything bad. Um, about true stuff. She had every one multiple times and has lost 3 body parts because of it. So, I mean, I don't know what dose she was doing. She might have been doing the highest dose that they can give. I don't know. But I'm yeah, I'll just leave that there. So, benefits are, of course, weight loss, and some of you like to count calories, and that's fine if you want to, but one of the benefits is you don't have to, and I'm not going to. I don't weigh my stuff. I do have a food scale, but I use it to make my products. Neurological conditions, so epilepsy, Parkinson's disease, Alzheimer's disease, and migraines have been shown to improve with this type of diet because of the ketones from fat metabolism. When that occurs, those cross over the blood-brain barrier, the ketones, and they are a cleaner fuel. The heart loves ketones, runs much more efficiently on ketones, but the brains work well. So, if you want to go out and look up like epilepsy treatments through diet in the 1920s and 30s, you will be amazed what you find, because it's going to be the keto diet. It's going to be high fat, medium chain triglycerides. So they knew about MCTs back then. And it was used until they had doctors or scientists or researchers or whoever decide that they could make a pill. And once the pills came out, that was the end of that. So when you feed the brain, and the brain is made up, so much of it is cholesterol. When you refeed those areas, you know, um, you're going to heal. So if you think about your brain, if you think about like spark plug wire, I don't know if you guys know what spark plug wires are. Maybe you do, maybe you don't. But anyway, they have a coating on them, a sheath over them. And if that would lay against the manifold, it'd burn a hole in it. And then when the electricity was running through, it'd spark out that opening instead of going down the line of that. So kind of like a nerve. And so we'd put black tape around that, seal it up till we could get another spark plug wire so that it wouldn't misfire. Well, in your brain, your body, your nerves, your cells, when you have deterioration, oxidative stress in those areas, then the same thing happens. It's like a hole gets burned through that coating. The only thing that comes in and fixes that is your fats. So if you can't get triglycerides and LDL to get up there to do its job, if you're taking something to block it, it's just going to keep happening. And then the more that happens, you make these plaque proteins. And the more you make those, they kind of piggyback on each other. Well, then it's kind of like a scar, and you're trying to get electrical signal up through that. It's not going to work. Um, and so I just recommend that you go out and look up that dietary treatment of epilepsy in children in the 20s and 30s and see what you find. So, what was reported most often was fewer seizures, better cognitive clarity, and reduced migraines. Um, I have seen this work with people with the long stage Alzheimer's. I don't, I can't personally say I've seen this slow down or do anything with like Lewy body's dementia, which is very fast. Maybe 2 years sometimes, sometimes less than that, from time of being diagnosed to the time that they actually pass away from the disease. But this is what I say. If I would get diagnosed with that, it's not going to happen because of how I, but if I did, I would be living on MCT oils, coconut oil, and animal fats. I probably wouldn't eat much protein because at that point, I just need to get everything into the brain. It'd probably be 6 to 8 ounces of protein a day for a while until the system cleaned itself. And I would be doing lots of fasting. So if any of you guys here have family members who have had Alzheimer's dementia, did you ever notice that it was like, even if they hadn't been somebody who had a sweet tooth in the past, that all of a sudden it was like they can't get enough sugar and junk and carbs and carbs. And that's because the brain is trying to get food, and those carbs turn to energy quickly, but they burn off, fizzle out, and then they leave behind all this crud. So it's just dirty fuel basically. But the brain knows that, hey, I need this fuel and I need it fast because I'm using a lot more energy trying to fire all these things. So they tend to want starchy, junkier foods more often. That's what I've seen. Skin conditions, eczema, acne, rosacea. Acne. I personally can tell you 100% without a doubt that I had horrible cystic acne, which is like around when I was going through menopause. I didn't have acne as a kid or a young adult. I got it at like 47, maybe 45 to about 49. And then when I went carnivore, gone. And then I started making my own facial serum and putting that on. And so I don't even have the scars. Like I have smooth skin. I don't have the scars from it. And I did. I mean, I had not horrible pits like you see, sometimes. Um, I have a nephew who has really bad pitting, but he's using the serum right now. So we'll see, hopefully. I'm not sure he's cleaning up his diet because he's a teenager, but what can we do? So, potential triggers of like acne, eczema, rosacea is sugar, gluten, seed oils. Um, and I think part of the reason that the way we eat kind of helps clear that is not only through keeping that bacteria down, but it is adding collagen because of how you eat. And a lot of you guys, add collagen in with your coffee and stuff, and zinc. The higher in zinc helps. So, clearer skin, healthier skin, stuff like that. Mood and mental health. Examples are anxiety, depression, and bipolar disorders. Another one that I can 100% say that carnivore definitely allowed me the ability to get rid of my venlafaxine. And I had got started on that in a divorce many, many years ago. Um, and there again, I let a practitioner talk me into doing something that I should not have done because I said, well, I feel like this is not clinical depression. I feel like this is situational depression. And once I can get through that, I think I'm fine. Um, and that was no bueno. And stayed on that for 6 years or 5 years, 10, 11, 12, 5 years. And when I started carnivore, it took a few months, but I was like, it was kind of weird. It was like everything was kind of grayish casted. Even on bright sunny days, it was like it was still kind of gloomy. And I thought, well, that's weird. That's how I felt before I went on the medication. And now I'm taking the medication and I've cleaned up my diet. And I thought, well, I wonder what'll happen if I start stepping down. So I had told my doc and she was like, oh, I don't think that's a good idea. And I was like, yeah, okay, well, I'm going to do it anyway. And I was careful, and being a nurse, I know how to step down those things. So I did that. It's the best thing I ever did. I'm so glad I did that. So, um, it definitely cleared up my anxiety, depression. I don't have bipolar disorder. I do have OCD, which I still have a touch of OCD. I'm not sure it's the bad kind because not that there is a bad kind, I guess, but I'm not like the person who had to turn the door handle like 27 times and click on the light 3 or 4. I had a patient that had to wash her hands 11 times every time she went to the bathroom. Like that was just her thing, 11 times. But I am a neat, orderly, like I like this to be in this spot, this to be here, to follow here's your outline. You stay in the lines. That's me. and they say that's OCD, so okay. So, I think a lot of the reasons that this diet helps with that is because it stabilizes your blood sugar, reduces brain inflammation. Look that up. The brain inflammation's crazy. And it increases how your neuromuscular system works. You know, it allows your neurotransmitters to work much better, partly because of the high amount of B12 and your omega 3s. So, what I found was improved mood, definitely reduced anxiety, and I'd say I don't fly off the handle quite as easy as I used to, because I really used to be like, no filter, no nothing. So, and sometimes I still don't. It depends. I reserve the right to fly off the handle sometimes, right? As we get older, we get to do that. Um, Chronic pain and inflammation. So, fibromyalgia, chronic fatigue syndrome, and arthritis. So, removing the inflammatory foods produces anti inflammatory um, effects, that are due to like the increased fats. I think those omega 3 to 6 ratio is really important to pay attention to, which is why it's okay to do, some of the fish, or if that's all you eat is fish, that's fine too. Um, I just think wild caught being mixed in with some of your like pond rays is probably a good idea, because the pond rays fish do have a higher omega 6 because they're not fighting against a current all the time. So their omega 6 is higher than 3. So that's something to think of. I think you'll have reduced pain and improved energy. So, cardiovascular. So, high blood pressure, elevated triglycerides, and low HDL. So, the reason this diet can help is because it reduces your insulin resistance, inflammation, while it improves lipid profiles. Now, that's us in the world of carnivore and ketogenic lifestyle. Knowing what we know now is that some of these numbers need to be much higher and some need to be much lower than what we originally have been led to believe. Um, and all I'll say is look up Dr. Ansel Keys and the 7 country study, which was actually 22 country study, and then you'll know. So I think the reason that this diet will help with that is because of it. Lowers the blood pressure. The reason that this is how I think, this is my chemistry mind, is knowing that when you eat this way and you have the increased fats, your LDL is nothing but a carrier molecule. It carries your immune system, it cleans up house. It's kind of like the vacuum cleaner, it drops off, the good stuff, picks up the bad, kind of brings it back and dumps it. And that's kind of how that system works. I think that's partly why it helps, but I think the elasticity in your arteries, all your blood vessels, but especially those arteries that need to have that really good stretch, kind of like a high pressure brake line. You want it to be strong, but be able to flex. I have to believe that when you are blocking it's such an important item as cholesterol from into the body and blocking what your liver produces. If you're taking a statin, you're doing both. Um, course you're not gonna have the stretch. I mean, doesn't that I mean, that to me is just common sense. So that is another way that that helps reduce blood pressure, is because it allows um, that stretching effect to happen, which is super uber important, I believe. Just 2 more. I better check and see. Oh, hi, T. Lewis. How are you? I'm going to have rotator cuff surgery next week. I was told I need to drink a bottle of Gatorade the morning of because I need the carbs to prevent nausea from the anesthesia. I disagree. Equivocally, unequivocally disagree. I have never heard of anything like that in my life. Okay, so back in 2019, I had a 7.5 hour surgery. I fasted for 7 days, water fasted with pink salt only. 7 days prior to that surgery, only allowed them to hang normal saline, no D5, no nothing else, normal saline. had the surgery. My blood sugar was 50. Let's see, I ran 15 miles that morning. So I think my blood sugar was 55 when I got up that morning. I ran the 15 miles on my treadmill, showered. I think I went down to 54, went, had the surgery done, came out at like 4:30, 5:30. Might have been later than that because it was like dark. Anyway, and my blood sugar had only dropped one more point. I had no anesthesia, nausea, and I was completely under. This wasn't done with just a epidural, even though that's what I wanted. Um, but I do, in the past, I have had the nausea with that. So what I would recommend is asking them, why don't they give you something like ondansetron, which is Zofran, Compazine. Those are things that can be given to you by the anesthesiologist prior to you coming out. Another one that they can give, say Compazine, Zofran. Another thing that you can do is you can have whoever goes with you when you have this done, bring peppermint oil and like a cotton ball and put peppermint oil on a cotton ball. And whoever you have with you when you get back out of post-op, every so often, just do that if you start to feel queasy. But I don't know. That doesn't make sense to me that taking in carbs is going to keep you from, I don't know what they mean by that. I don't know. Maybe you come back and let us know what they thought and ask them, well, what's your medical idea behind this? What's your science that you have that says that this is going to, I don't know. I've never heard of it. Maybe they have, but I haven't heard of that. So that's all I know. But let us know how it turns out. And good luck. That's a rough surgery. But hopefully if you're eating this way, that will help your inflammation stay down. And I would recommend um, if you can fast a little bit during that time, you will heal a lot faster too. Sorry if you're not a faster, but that would help. Let's see, Simpson. I'm late. Oh, that's okay, Simpson. Not a problem. The first 10 minutes was me talking about healthcare and them not doing what we ask them to do, but that's okay. Um, let's see. I had hernia surgery and they wanted me to drink Ensure. Oh my God. Very good, Kat. That was the other thing. Thank you. I was going to say is electrolytes. Make sure you have electrolytes and water. Um, and they're not going to want you to drink much ahead of time. So I would just do like some of the Himalayan or the Redmond's Real Salt, Celtic, Baja Gold, any of that. I would do several pinches of that under your tongue prior to you going in to keep those electrolytes up. Yes. Yes, I would. And the anti-nausea meds are not something I would ever do long term, but for short term, for something like this, I would. But yeah, I've never heard of that. So, and like I said, maybe there is. Let's see. I just did search for the carb drink with anesthesia, and it is recommended and helps with post-op nausea. Never heard of that in the past. I've never heard of that. I'd like to know what study and what science they're using for that. I don't know what that would be. But yes, that's crazy. Okay, so the next thing is food allergies and sensitivities. This is me. This is me 100%. So, like gluten intolerance, lactose intolerance. So, the reason that this will help if you eat, ketogenic carnivore diet is because it simplifies the diet. Hell yes, it does. Removing common allergens. So, I cannot, and I don't know that I have an actual gluten intolerance. I think I have a glyphosate intolerance. Let's just be honest. Because moons ago, I could eat like your really good quality breads that were not like 37 ingredients. And, years later, I could eat a little bite of something that was bread and it would just sit in my stomach. And it felt like it was back to like the dough consistency, like a lead ball just sitting there. So it's not like I had like the gluten issues that you hear about, but it just did not want to process. But it's probably glyphosate, really, if we just want to be honest. But I am very lactose intolerant. I can do a little bit of butter, but I'm better off if I just stick with ribeye fat or ghee, um, which is easy to make. So, and as for simplifying, my mom was saying something yesterday. She was like, "Oh, are you going to make this, this, and this for Paul?" And I'm like, "No." And she was like, "Oh, that poor guy." And I was like, "Poor guy." I was like, "You do realize he was 49 when we met and he had never been married, right?" So, poor guy knew how to cook prior to me moving in, and it's not 1950, and I work full time plus a side job. So, no, I will make the main course, and then, if there's something extra on the side he wants, okay. He's a big boy, he knows how to do that. And I said to my mom yesterday, I said, "I don't want to take up I don't have the extra time anymore." Because anytime I get extra time, I find something to fill it, whether it's crocheting, which hopefully I can do again for a longer period of time without getting dizzy. Because right now I still have a little trouble doing that. Um, but I was like, it's so easy to just throw a pound and a half of burger in the refrigerator before I go to bed, and the next day it's thawed out and ready. I mean, that's it. It takes 5 minutes to cook it, and I'm done. Why would I want to go out there and spend 45 minutes so that I can make something that, for one, I'm not going to eat? Number two, I feel bad feeding it to you because I know that it's poison. Like, I don't want to do it. I'm not going to do it. And my husband's fine with that. He likes to make his stuff his way, and rah, go for it. So, the benefits to that is fewer allergic reactions and improved digestion if you can avoid those things by eating this way. So a lot of people have to talk themselves into looking at this as just an elimination diet, which is fine if which is really kind of how I started. I started really accidentally about 3 weeks before I saw the Dr. Baker on, that guy that has a podcast, Joe Rogan. And I had done I had cleaned up I was keto. I was doing keto cooking videos with a friend on Facebook together. And what happened was, I just decided I'm going to clean everything out. I'm going to do nothing. So I did no milk products, no this, no that. And it was basically, we decided to make broccoli cheese soup, I believe was the recipe we were making. And so it had some whole milk and it had some cheeses in it. And I remember I took one bite just to taste it. I was like, yeah, that's okay. And I went and sat on the couch after that with my husband, and he was like, "Why are you clearing your throat constantly?" I was like, "I'm not." And he goes, "You are." I didn't even realize it, but it had produced all that mucus and inflammation in my nose and my throat, my sinuses. And I thought, okay, that makes sense now. So then I kind of cleaned up my diet for a week or two, felt pretty good. Um, didn't know what I was doing, didn't do the extra salt. Then I saw the Joe Rogan and Dr. Baker, and I was like, that's it, and went head into it. So, and yes, it's the best thing I have ever done for myself. So, hormonal imbalances. So, examples are PCOS, hypothyroidism, and low testosterone. Um, these can help with this because that increased, for one, you're going to improve your insulin sensitivity and the fats that are needed, because cholesterol has to be in there for most of our sex hormones to start from. So you have to have that. And even if you have went through menopause or you had hysterectomy, a full hysterectomy where they took your fallopian tubes, ovaries, and your uterus, your adrenal glands that sit right on top of your kidneys will kick in and produce some of those hormones, not to the high level that those did, but enough to get you by. But I think the more fat that you do in your diet, I have found that the higher fat I went, the better off I felt and the better off my hormones were. So that would show up in a couple different ways. So if you're still, say you're a menstruating female, you would have better cycles, less pain. I think I was watching Jen Mann talk about her. I think she said she was like 277 days now carnivore, and she had suffered with like migraines and horrible periods, and I mean just bad PMS, bad, bad, bad. Um, and then they had 4 daughters on top of that. That was a busy house. And how she said it's so much improved all of that with her going carnivore. So that's nice to hear. You'll have the increased energy with the fat. And that is something that some doesn't always show up very fast. Um, and it doesn't stay the whole time. So you will have ebbs and flows. So there will be times where um, I have to eat higher fat to get to that point of where I feel that energy. And it's based on what your body's dealing with, whether you're exercising really hard, whether you're sick and you're fighting something. Um, stress, stress, lots of stress can do that. So that is my talking points for the night. Let me see if anybody has any other questions. Ta-da. Yes, Simpson. I am still sounding a little rough, but boy, if you'd have seen me Saturday. Um, I got one more dose of elderberry tincture to do tonight, so that will help. That's been helping me. Once I knew what I was fighting, it was so much easier for me to tailor what I do because I don't take oregano and elderberry every single day. I take it if I start to feel something, if I know I have something, things like that. And for the last few weeks, we've had whooping cough. We were told it was COVID, but of course, I work at the health department and we know if it's truly COVID. And anyway, when those samples were sent for serial testing and blood testing, it was not COVID. Showed up very much like COVID, but was not. I'll probably get kicked off the channel for saying the word 15 times, but I don't care. Um, so yeah, there is that. So I want to thank you guys for watching, and I will be back Monday at 5:30 p.m. Central Standard Time. And let's see, next week's going to be all about carnivore for babies and children. Um, so yeah, I'm going to go over the benefits, the challenges, age-specific kind of guidelines, stuff like that for next week. And I want to let you guys know, I hope you guys have a good holiday, a safe holiday tonight. Stay off the roads because there will be people out there drinking and driving. So avoid them if you can. And have a wonderful next New Year. Don't forget, starting tomorrow is World Carnivore Month. So I plan on eating a ribeye tomorrow. I haven't had a ribeye for probably a week just because I just my body knew I needed to digest easier, like hamburgers a little bit easier to digest. I just was feeling something was off, which now I know it was this nasty virus that they can't seem to put their fingers on. But wanted to give me an antibiotic for, which I don't understand that either, but that's okay. Um, it's all good in the hood, right? All right. Well, thank you guys for watching. Hello. You have a happy new year as well. Let's see. Yes, the next show will be in 2025. Oh, great, Simpson. Good. So Simpson was just saying, thanks for doing this chat. I've started the biotin and been doing the carb-free Knox blocks for my hair, and she will see what happens. Perfect. Yes. In fact, I almost made some of those gelatin blocks today, and then I just was like, I got up and did more than I probably should have, and kind of petered out all my energy. So, and I haven't been able to eat as much fat because I haven't been hungry. So tomorrow I have a bag of fat thawed out, and I'm going to hit the fat really high tomorrow, probably very minimal protein unless I'm hungry. But I am going to probably make that Knox gelatin as well. So thank you for reminding me that I said that, because yes, I did. Happy New Year, Carnivore Santa. So anyway, I appreciate you guys watching. As always, if you like this, share it out with somebody. Um, and like I said, if you have IBS, if you have a lot of these conditions, look up specific people out there. You know, Dr. Berry is a good resource. Dr. Hampton, Chafee, Baker, people like that. Dr. Kiltz, Lisa Wiedemann. You know, different people like that. And then specifically, you know, if you are dealing with IBS-C, IBS, ulcerative colitis, GERDs, Crohn's, I would absolutely look up. Um, I would look up Lee, which is Kent Carnivore. Okay. He's just got a really good attitude. He's a good dude. Been through a lot, but he's tough. So, anyway, thank you guys for watching, and I will be back to see you guys next Monday. And as I always say, meet, heat, eat, and repeat.